Hello, my name is Tracey T.
Tell me a little about yourself. How would
As a child, I always wanted to be a nurse. I always loved helping and caring for people. When I first started in school, I started off with a degree in healthcare management and a minor in business administration. I've been an LPN for 4 years. 3 years I worked in long-term care, and in this recently I became a pediatric nurse. People would describe me as being a humble, loving, and caring nurse.
what do you see as your strengths? Why?
I would say some of my strengths would be that I'm organized and efficient. Um, and the reason I say that is because when I go to work, I always organize and plan my day with my patient care and treatments, and I always get it done efficiently. I will also say I'm a great team player. I love helping and caring for everyone, not just patients. So whenever my peers are in need, I always lend a hand to assist.
How about your weakness?
I would say one of my weaknesses is that sometimes I can overanalyze things since I want to be thorough in my work, and I recognize that that can be counterproductive with time management. So, attending nursing school and working as a nurse helped me better prioritize and organize my work so it can be thorough and do it in a efficient time.
Tell me about your clinical experiences. Which rotation?
I had plenty clinical experiences. I would say my first rotation was in psych. I did that on a adolescent unit with a lot of patients who had ADHD and autism with behavioral issues. And I also did OB pediatrics rotation, which was my favorite rotation. I think it was my favorite rotation because it was a positive environment, and I love working with children and interacting with children in a positive environment. That's the great experience that I had.
What is the biggest mistake you ever made while
One of the biggest mistakes that I made was when I was counting narcotics with another nurse. It was my first day on the job, um, free of orientation, and I was counting the narcotics and dropped the narcotic bottle on the ground, and it bursted everywhere. I was very nervous. I was scared. Thought I was in trouble. I called my nurse manager over. She witnessed that the medication was wasted on the ground by an accident, so we filled out an waste form and submitted that form. And then I was able to call the doctor, get a C2 form filled out, and faxed over to the pharmacy and got the medication reordered and sent back to the facility so that the patient can have it readily available for the patient.
tell me about a staff nurse who most impressed you.
One of the staff nurses that most impressed me was my preceptor in med-surg. She was a LPN for 25 years and an RN for 4 years. She's very thorough in her work. She also was very good with respiratory and cardiac. She was very good with physical assessment, and she was able to read EKG strips and teach me how to better read those. And she impressed me very well.
How would your most recent nursing experience describe the importance in the clinical setting?
I think my preceptor would say that I increased my skills on physical assessment. That's the first things, one of the first things we did during my clinical rotation. She taught me thorough physical assessment skills. We both did the physical assessment skills, and she said that I increased more on those and also on prioritizing and medication administration.
What skills have you gained from your past work experiences that made you become a professional?
I would say physical assessment skills and also medication administration. I was able to administer medications via IV, IM, sub Q, and also via G-tube. And I think those skills helped me improve.
Tell me about your most challenging clinical assignment and what you learned from it.
One of my most challenging clinical assignments was when I had a patient who was combative. I went into the room, introduced myself, and started to do a procedure, and the patient began to get irritated and started yelling and fussing. It started to escalate and hit. So I decided to stop what I was doing, leave the room, go revisit other patients as far as assessments, and then I revisited that patient later with another employee, introduced ourselves, explained what we're doing, and were able to successfully complete the procedure.
What are your future career plans? Where do you expect to continue?
My future career plans is I plan on obtaining my master's in nursing and becoming a nurse educator. I love teaching. The areas that I would like to teach in is probably most likely OB, being a L&D nurse, being a breastfeeding educator, or maybe even being a wound care nurse.
We do not have any openings at the present time. Would you be willing to accept a position? If so,
I think that I would be able to accept another position in another area. Mainly, I would choose medical surgical, and the reason why, because it's a multiple patients with different diagnoses that would keep me updated on all different types of patients. It would also help me to be able to continue administering medications, completing treatments, and also I would be able to still teach.
tell me about a time when you had to
One of my clinical experiences I had established priorities in was in my recent med surge rotation, where I had a patient who needed to have multiple antibiotic therapy hung at one time. And then all of a sudden, I had a patient who was displaying symptoms of autonomic dysreflexia. I thought the first thing I should do was assess the patient with autonomic dysreflexia. I did once I did my assessment on that patient, the urinary catheter wasn't kinked. What we realized is when I turned the patient over, he had a bowel movement. So we were able to clean that patient up, get that noxious stimuli away from him, and then his blood pressure started to decrease. And I was able to still hang the antibiotic for the other patient a half an hour early so that we can get the second antibiotic running to get the patient's medication in.
tell me about a time when you went out of your way to assist a family even though you might not have time.
I've had plenty of opportunities to have patients that needed my help when I didn't have the time, but the one that stands out for me the most was when we were short staffed. We didn't have a medication aid, so I had 39 patients. I had to administer medications, administer treatments, and answer call bells. And as I answered one of the call bells, I had a patient who had a bowel movement that needed to be changed. And um, the nursing assistant was not available. Therefore, I felt the need to help the patient. So I went ahead and got the necessary supplies needed, helped the patient get cleaned up and washed up, and then proceeded to go on with my day and then taking care of my other patients.